April 20th, 2021. This is the BE collection. This is Dr. Jennifer Black. Were you able to hear that okay? Good.
Yes.
Thank you. So we'll just go through a series of questions and have a conversation, basically. You and I have talked already.
Yeah.
It was suggested, and I'll support this idea, that we start by having you state the different careers that you have participated in your life.
Oh, okay.
Right.
Sure. After I graduated from college, I had a career of raising children for a few years.
Uh-huh. How many children?
I have 2 children, one son who turned 38 yesterday and a 36-year-old daughter.
Huh.
So they're close in age and not quite how I had intended to start out my life at that time. And they know that, so it's okay to say that. And after that, I became a data entry person and a babysitter and an aerobics instructor.
Oh.
And then I went into retail and did retail management for a company called Gymboree.
I'm familiar with that.
The chain of stores, and helped them open 43 stores. And then I worked in their corporate office for a while. And then I decided, after
this is
watching
all while
my
you were
mother,
raising your family?
while I was raising my family, yep, and going through divorce and going through a lot of change personally.
Mm-hmm.
And I decided, while watching my mother go through her cancer treatment, which she did for 13 years, that I just really didn't want to sell more of something for my career.
Mm-hmm.
And I decided to go back to medical school. So I did that while working part-time, while raising my kids. And it took me a long time to finally get into medical school. When I finished, I was 40. So I started a bit late. I went to USC.
Uh-huh.
Mm-hmm.
And were you divorced during that period of time, or were you?
I was divorced during all of that time.
Mm-hmm.
And I had a couple of relationships after my divorce with women. Mm-hmm. But when I entered medical school, I was a single mom.
Uh-huh.
So it was
relationship then?
I was not until my second year of medical school, when I met someone in the class ahead of me. But for much of the time in medical school, I was juggling kids in school.
So big effort. Impressive.
Yeah, it was. If I look back on it, I don't know quite how I did it, but you just do those things, I guess. Plow through.
At what point in your life did you were you aware that you were a lesbian, that your preferences were different than what is expected?
I think I realized that young, maybe junior high or high school, but I didn't act on it and I didn't recognize it. I didn't understand what it was. And once I started to understand that, I didn't have a role model or anyone who would make that okay for me to explore.
Mm-hmm.
So I didn't. I did everything I could to try to fit in what I saw my family portrait to look like. And so I dated men, and I married a man when he and I traveled in Europe together after college, and I got pregnant. And that's the father of my children. We still have a good relationship, but I finally realized during that short marriage that this is not my direction. This is not who I am. And it really took me a long time to sort that out.
It's a big sorting.
It was a big sorting back then, at least, I thought. And it's interesting because I have a niece who's 22 now, who's exploring a relationship with a woman and doesn't feel the need to hide it, doesn't feel the need to define herself, doesn't feel the need to pretend. I mean, it's just, to me, that's so much better.
Maybe that's because
that's because what? I'm sorry.
You, her connection.
It may be because of me. It may be because of me. I hope so. I hope that's helped. But I think also generationally, things are changing.
I agree.
Which is so good to see.
I wish that I would have had a lesbian role model that was out. I was in contact with a lot of lesbians, of course, because I was alive. But so
As we all are,
to have
just
you
don't
is
know
great.
it. Yeah,
Right.
yeah, yeah.
So where were you born?
Yeah.
What?
I was born in Arcadia, California,
Ah,
and I grew up in Glendora, California. Lived there till I went away to college.
ah. So you have siblings, obviously.
I do. I'm the oldest of four.
Mhm.
Two brothers and one sister, and two are in North Carolina, and one lives in San Clemente.
So did your mother's long, prolonged illness help direct your career in medicine?
It 100% did. It's part of the reason that I chose to go back to medical school. And initially, I thought that primary care would be what I wanted to do because I wanted to help people lead healthier lives. And as I went on through my training, I learned about hospice. And interestingly enough, my mother was never offered hospice.
Huh.
She died in 1990 in the hospital, and she
In
spent the latter
California?
6
Did she
in
live
California,
California?
in Huntington Memorial in Pasadena.
Mhm.
She was spent the last 6 months of her life really in and out of hospitals, never having her pain managed, never having her symptoms managed well, and never having anyone telling her she was dying.
Huh.
So her last hospitalization, her physicians would come to the door of the room and they would step in the door and say, "How's your head pain today, Carol? How's your leg pain today, Carol?" But nobody said, "Here's the whole picture. Here's what we're looking at. Here's what's really happening."
Uh-huh.
So she suffered greatly. She died in pain, and that definitely directed where I went with my career. Because once I learned about hospice, I knew that was something that we should have had offered to us.
Mhm.
I also learned that it's often not offered because physicians don't do death very well. We
Correct.
seem to be trained to keep patients alive, prolong their life, do everything we can, but we don't, death seems like a medical failure to us. So I had to relearn that. I had to look at things differently, and really, quite frankly, faced a lot of obstacles in my career because that was not accepted. Had a physician once tell me, "You'll just give her morphine and she'll be dead in 2 days." Had a lot of people who just objected
Probably
to.
his wish for himself.
Right, exactly. But it's interesting because most physicians do want
Nobody
a
wants to hang
comfortable
on.
end of life. Yeah,
Mhm.
exactly.
Were you in medical school when your mother was ill?
I was not. I was taking pre-med classes and thinking about going to medical or actually planning to go back to medical school and taking care of my kids. And she died before she knew I got into medical school.
Hmm.
So I got in shortly after she died.
You mentioned going back to medical school. Had you already started and stopped?
No, I mean, just going back to school.
I see.
Going back to school. My original majors were economics and psychology. So that was what I had a degree in. So I had to go back and take biology, chemistry, physics, microbiology, molecular biology, all of that stuff. Yeah, all of that stuff that I don't use anymore.
Right, which is probably good. So
Yeah.
how about your father? Where was he?
Yeah, he was in the picture. He was a dentist.
Mm-hmm.
And he encouraged me to go back to school for medicine. He was very supportive, and he wasn't the driving factor in the way that my mother was, but he was definitely a driving factor in, as a single mother, having me find a career that would keep me secure and allow me to support my kids as time went on. And so he allowed me to live in the house that I grew up in during medical school, free of charge, which was greatly helpful.
Right.
Mm-hmm.
Is he still alive?
He died of Parkinson's disease last September.
Oh.
Yeah, but he had hospice care. He had actually the hospice that my wife started. She and I met at work, and she had started a hospice program. Mm-hmm. And we called on that hospice to care for my dad at the end of his life. And we all had a wonderful experience. So Susan actually took care of my dad did a lot of hands-on care for him, and they had a marvelous relationship.
That's great.
So, yeah.
So where was that? Where?
The program is originated in Bakersfield, but my dad lived in Glendale. So her hospice program is all through the state of California. And he died in his beach house. He has a beach house in Balboa Island.
All right.
Yeah. So he was there, we were all there, and it was a good experience. Much different than mom's, and much more rewarding, I think, for everyone.
I noticed that you have in your photos that you spoke on, you speak or on end of life care. Is that true? Yeah.
It's true. I'm very passionate about helping people have a good end of life experience, and having access to palliative care and hospice and any programs that can help them, and also helping them understand advanced care planning and advanced directives, because too often we see that people's wishes are not fulfilled, not respected. And so I've worked on that for years. And in Bakersfield, where I spent most of my career, I know people from Bakersfield are going to see this, but I'm just going to say that they're about 10 years behind everywhere else in the state and everywhere else I practiced in acceptance of good end of life care, of hospice care and palliative care. So I probably did an educational program at least once a week for years down there, either to physicians or hospital staff or lay people in nursing homes or churches or Rotaries, wherever people would listen. And I was invited to do that since Bakersfield has the feel of a small community. A lot of people knew me and reached out to me. So it was great to be able to provide that education to people.
Are you still doing that? Any of that?
Not so much up here. I came up to a much larger program here with, fortunately, 15 other physicians in my program that do what I do. So I'm not unique here, really. I'm not. And
you're in Portland, Oregon?
I'm in Portland, Oregon. Yeah.
Okay.
So it's much less, I'm much less unique in what I do, and it's much less needed, frankly, because there's much better use of hospice care here, and end of life care is much better. And I think it's partly due to the death with dignity law, which passed here, I think in 1996, because part of the result of that law passing was not that necessarily that more people took medications to end their lives, but more that they actually were given the opportunity to have better palliative care and better end of life care. So almost everyone here has a advanced healthcare directive or a PULSE form, which is a physician or portable orders for life sustaining treatment form. So there's less need for me to do that work, which I think is a good thing.
Mm-hmm. So now you're still working, you're still practicing.
So I'm still working. I came up here and became a hospice team physician. And then I became the hospice medical director for the group. And then I became the chief of the department, which I did for 2 years, which was something I would not choose to do again, because it's all administrative work, and and that's not really my thing. Mm-hmm. So now I am a hospice on-call physician. I work 100% remotely, and I love it.
Mm-hmm. Great.
It's great. I get to stay home and smell fresh baked bread that Susan's making, and
sounds good.
And we're just really we're enjoying her retirement, because she's retired and cooking and baking and doing cool things, and I get to be with her.
That's great.
So it's great. Yeah.
That's a gift. I call that a gift.
It is. It is a gift. Absolutely.
So you met her in Bakersfield?
I did.
How did you get to Bakersfield from California?
Well, interestingly, you probably know how the match works when you're a resident, when you're a medical resident and you choose some programs, you interview at programs and you rank. At the time, I was with someone who I met in medical school who matched in Bakersfield. Huh. And I thought we were going to have a longer term relationship. So I chose to match in Bakersfield as well. And as it turns out, that was a good choice for me, because it was an excellent program that I attended. And it was a good place to raise my kids, albeit more conservative than I would have chosen. It was safe and it was affordable.
Mhm.
So we could have a nice house on the salary of a resident, which is, $2 an hour, something like that, if you count all the hours you work. And it was fine. But then I got a job with Kaiser. Well, is it okay if I say who I work for?
Absolutely.
Maybe not. I got a job with Kaiser Permanente in Bakersfield, and I stayed there for 18 more years, even though my kids graduated from college and moved on. And I met Susan because I was representing Kaiser Permanente as the hospice medical director, and had not been working with her hospice program. And it was pointed out to me that I should meet with the director of that program, and I did, and that was Susan.
Mhm.
And we became friends, and we became more than friends, and it was wonderful. I never would have met her had I not been there. Susan was born and raised there, and she kept trying to leave and kept coming back. So finally I had to say, okay, I'm putting it in my advance directive. Don't let me die in Bakersfield. We're going to move.
Probably other people feel like that too.
I think so. Yeah. So we moved to Portland in 2015
Mhm.
for a job for me. And then she took a job at Kaiser Permanente as well.
Great.
And she just retired last November.
So are you affiliated in Portland with a particular medical center or hospital?
Well, Kaiser up here has its own hospitals. So we have two, one smaller and one larger hospital. So I have privileges at those hospitals and have at times done inpatient palliative care consultations, which really what that means is going in to meet with a family whose family member is not doing well, and trying to assess what their goals of care would be if they could speak to us, or speaking to them if they can, and then helping them have better symptom management while they're in the hospital, and then find support for them once they leave the hospital.
It's a very
So
comprehensive program.
it's a great program, and we have 16 physicians and nurse practitioners who are doing this at our two hospitals, in clinics, in what's a home-based palliative care program, and in our hospice program.
For the benefit of understanding, how would you define palliative care?
Palliative care is comprehensive care for seriously ill people that focuses not on a specific disease process, but on overall quality of life. So everything we do is based on what the patient says is important to them: symptom management, family support, education about the trajectory of their illness if they want that, guidance as to how to plan as things get more serious, and eventually a transition to hospice care if that's something that they would benefit from and would want as well.
So if someone listened to this and wanted to contact you regarding speaking or their own personal questions, how would you be open to that?
Sure. Yeah,
Okay.
sure.
Because
not-
go ahead.
Go ahead. I'm just not
Oh,
sure how
I mean-
the best to have them contact me, but
People are pretty, sometimes they contact us.
okay.
Right.
Okay.
So we just need to have your permission to do that. I can see that happening.
Yes.
Because
Okay.
you're so interesting and passionate about this that, and people don't know what to do still.
I absolutely am. And I know oftentimes people don't know what to do, and it's
That's
very
right.
rewarding for me to help them do that. So yes.
I see hospice as a 3-day morphine infusion in the hospital.
Correct.
Right.
And that's
not
at its best.
talking
It's
about.
6 months or more, or years of really great helping care at home, where patients live where they want to live and live the way they want.
Do you see, or did you see being a lesbian in any way impeding your goals or your direction?
In my training, I wasn't open about it. I think people knew, but I just didn't really say anything. And I would say in training, it did not impede my goals at all. Actually, in residency, people did know, because I was relatively open and there were not any problems. But when I was working in Bakersfield, it's a very conservative community, as you know.
So I've heard.
So what I found was that patients would have signs on their front lawns that said marriage is between a man and a woman. And I would have patients say to me something about all those queers, or, just things that are just really derogatory. And I would have to listen and sit
Painful.
Quietly.
Right.
And it's painful. But I don't think it impaired my career progress, because I had the respect of my community and peers. And if they knew about it, it was just something that they didn't bring up.
Do you
I think,
Okay, go ahead.
I think I opened some eyes just by being there and being with a woman, and whether I said anything about it or not, I think they learned that, well, I think it's harder to hate a group if you know someone in that group.
That's
You
good
know
point.
someone personally and you like them, then you kind of step back and say, gosh, maybe my perceptions are incorrect.
Uh-huh.
And I think it made a difference. And overall, I don't think it harmed me.
Mm-hmm.
Maybe it was because I didn't start practice until the 1990. But maybe I was just fortunate.
Well, a lot of that's just you. I just think that in life experience, you brought a lot to your career, and you still do.
Mm-hmm. Mm-hmm.
That has a maturation with it. That's significant.
Mm-hmm.
Has there been any particular person outside of Susan that's inspired your life and your direction? And your mother? Yeah.
And my mother.
Right.
And I would have to say my grandparents as well, because during my training, my grandmother had a stroke, and I was a medical student at the time, and she was transferred from the hospital to a skilled nursing facility. And as a medical student, I went in to see her, and she begged me to take her home. She said, I took care of you when you were a baby. Please take me out of here. And I was a medical student. And so, one, I was busy. And two, I said, Grandma, your potassium is too high and your sodium is too low and your this and such is not good. And we have to get that fixed before we can get you out of here. And I left and I talked to her doctor, and I never saw her again.
Oh.
So that was a huge lesson in, people die with abnormal labs and with normal labs, and those things don't matter. Mm-hmm. We need to recognize when someone's dying. So that influenced me. Mm-hmm. And then my grandparents, my father's parents, died together in their living room overlooking the ocean within one day of one another. They were both on hospice.
Wow.
And I was with them, and I wasn't there when they died. I think they waited for me to go out and go running, because people do that. They wait for people to, right. Yeah, they wait for you to come in, or they wait for you to leave, depending on what they want. But I saw what a good death they had with the hospice program. And so later, when I had the opportunity to put a patient on hospice and then learn more about it, I was open to the idea. So that made a difference for me too.
Do they have the same illness?
My grandmother had congestive heart failure and macular degeneration, which limited her eyesight. So that made everything worse. My grandfather had pancreatic cancer.
Pretty common.
Yeah.
My mother refused to go on hospice, but it became clear that we needed to do that. So the hospice nurse was at the kitchen table filling out papers, and my mother died.
Oh.
Because she took one Valium, and that was it. But she determined not to go on hospice. So,
well, she pretty much got her wish.
She did.
Yeah, but if you signed up, you got 13 months of bereavement support, I guess, right? If you needed that.
No, we just thought,
that's a third of patients die within 7 days or less on hospice.
Really? Huh?
Yeah.
Know that.
Yeah, and the average length of stay is not much longer than that. So it's too bad that we still don't have better understanding. Your mom probably thought the same thing everybody tends to think, is if you go on hospice, you take morphine and you die. And in her case, it happened, but
she took a Valium.
Often
relaxed.
A Valium, okay.
That was it. The final Valium. She never really took Valium before, but she had it.
She had one.
She told
one of the
caregivers, I can't go any longer. She took the Valium.
Mhm.
We were filling out the paperwork, and
That was it.
I could hear her stop breathing. And I said to the nurse, she's gone. Oh, no, no, no. She was.
Yeah.
Mhm.
Wow.
That was her personality. So,
Mhm.
and I'm happy for her, actually.
People die in the way that they lived, and that's just fine.
That's another story.
Yeah.
So did you have support behind you to direct your path, or were you sort of out there on your own?
Well, support professionally, you mean?
Anyway, right.
Well, I had great support from my dad, who helped me with the place to live, and just actually, when I won a couple of National Kaiser Awards, he attended with me, and he was very supportive of my work.
What awards did you get? Did you receive?
I received one was called the Physician's Exceptional Contribution Award, and it's given to a physician at each medical center or service area, they used to be called, for work that they've done to help in the community and to help their colleagues. And I received that for my end of life care work. And one of them was called the David Lawrence Community Service Award, which is given nationally for either individuals or groups who've done volunteer work that's made a difference. So again, that was for all of my lecturing and teaching and all of the advocacy that I did for end of life care, which was really wonderful. And my dad attended the award presentation with me, which was great.
I think you have a photograph of that, actually.
Yeah, I do. Yeah.
Your photographs are great.
Thank you.
So how do you center yourself?
I exercise.
Mhm.
I calm my mind best when I'm moving my body. Mm-hmm.
So what advice would you give to lesbians of any age who want to change their career direction and don't really know if they should or they shouldn't?
Find some mentors, find some lesbians who do the works that you're interested in, shadow them, follow them around, learn from what they do, learn about any obstacles that you might face. If you have kids and you need to go through training, make sure that you have people to support you. If you don't have a partner, then lean on family members or other people who can support you through the process, and go for it.
If you knew you were dying soon, what would you like people to remember about you?
That I was adventuresome and fearless in many ways, that I really wanted to make a difference in the world. And I would encourage people to do what they love, to follow their dreams, and not be afraid, and don't hide who you are.
I understand that.
Yeah.
And be kinder to other women. How about that?
Be kinder to other women. That's a good one. Yes.
Well, thank you. But most of all, stay in touch.